we are here checking in once again. How is everyone doing? It's looking a little bit dark in here today. I hope everyone is okay. Just checking in again today. I wanted to address symptoms of COVID-19 coronavirus and also talk about self-isolation. So I'm just going to give you a few minutes, but a couple of minutes for people to tune in. And please do help me to share so that other people can watch from your different platforms as well. So give me a moment while I do that sharing on my own end as well. So give me a moment to share that. Let me share to other people, and then we can get on with it. Hope everyone is having a good day today. Can you hear me? Yeah, okay. So give me a moment because I don't seem to have a sound on this at the moment. Yeah. Okay. So hopefully you can hear me, right? Okay. So yes, I wanted to talk to you about COVID-19 symptoms and also self-isolation, because I think it's really important that we are aware of the symptoms that we need to be aware of so that we know when is the right time to self-isolate. Yeah. So if you remember, particularly in the UK, it was about end of February, March, beginning, that we became more aware of coronavirus and actually the seriousness of it. But obviously, this had started back in December 2019 in China. And I think because it hasn't hit closer home yet, we didn't know much about it really until about end of February and March. And the symptoms that we were sort of alluded to or told about initially was a temperature and a cough. So if someone had a temperature of 37.8 and above, that was possibly, a suspected case of coronavirus. Or if someone had a new cough, and that cough was continuous. So by continuous, we mean, within an hour, you're coughing more than one time, or, within 24-hour period, you were having more coughs, okay? So this wasn't a matter of I cleared my throat. It was more you had a cough which was new and it was continuous. So I think a lot of us felt confident in that we could tell if we had a temperature, or we could tell obviously if we had a cough and this was a new cough, okay? So that's what we had. But over time, because remember this virus, coronavirus, COVID-19, this particular virus is actually new, so we don't know a lot about it. So over time, based on the cases that have happened locally, obviously nationally in the UK, but also actually globally, we've having a more understanding of how this virus works and how people can present. And actually, it turns out there's a whole range of symptoms that actually people can have with coronavirus. And I think this is interesting but also worrying, because it means that a lot of people may be walking around having some of these symptoms and actually not necessarily think that they have coronavirus. Because I particularly remember a lot of time when you speak to patients and then you're asking them about symptoms, and the moment you say cough, they say no, I don't have the virus, because they don't want to have the virus. So actually, they definitely know, it's a cough and a fever. So they feel happy that they don't have those symptoms. So anything else they want to tell you, they've already told you, doctor, I don't have the virus, but actually it's possible that people might actually have the virus and not know it because they don't know all the symptoms of how the virus can express itself. Okay, so I am just going to go through some of those symptoms that we know that have been reported, that actually cases that of coronavirus that we've reported those symptoms. Okay. So the first one is a phlegmy cough. Remember, if we remember at the beginning, it says a dry cough, okay? And actually for the majority of people that will have a cough, it will present as a dry cough. But also you can actually have a phlegmy cough. So the fact that you have mucus with your cough shouldn't make you think, oh, it's not dry cough, so I don't have coronavirus, because it could also be. And the other symptom is shortness of breath. I think now a lot of people are realizing that because we've heard a lot of cases of people needing oxygen. So we know that if you are feeling short of breath, and as you can imagine, these are all acute symptoms. So it's happening within a short period of time. It's not something that you've had for months or even over weeks, okay? It's happening over a matter of days. So if you are feeling shortness of breath and this is new, this could possibly also be a sign or a symptom of coronavirus. You can have muscle aches, joint aches, so you can have pains all over your body. That might be a presentation. You can have a sore throat. You can have chills, so still feeling hot and cold. You can have vomiting. So see, this is very interesting. You can have a vomiting, you can have a blocked nose, so you feel stuffy in the nose. You can have diarrhea, and you can have rashes. We've had, obviously, there's a lot of information sharing among doctors, among healthcare professionals, just to also make us aware, actually, that, these are the things that the hospitals are picking up, so that even we as GPs are aware when we are speaking to our patients. And one of the things that, has come out is actually people might also just present with a rash, So this is interesting. What is interesting also is that children might actually present a bit different to adults, okay? So children typically might present with abdominal pain. They might present with GI upset, so they might have diarrhea, they might have vomiting. And it's so easy. As you can imagine, most of these symptoms are very non-specific, okay? Because, you can have sore throat, just a simple sore throat, and not necessarily because of coronavirus. You can have a headache, So some of these symptoms are so non-specific. They could be due to something else, and commonly could even be due to a flu, due to a cold. So it's so easy to say, oh no, I don't think it is, but I just need to make you aware that these symptoms could also be attributed to coronavirus. So let's go through them again. A phlegmy cough, so it's not just a dry cough, okay? You can actually be bringing up phlegm. You can have muscle aches and pains, joint pains. You can have a sore throat. You can have a headache. You can have chills. You can have rashes. It might present as vomiting, diarrhea, and typically in children, they might have more of the GI symptoms, so gastrointestinal symptoms like stomach problems than they will with the other symptoms, okay? So this is something for you to be aware of. Now, this is really important then, because if you are, showing any of those symptoms and it's come on acutely, I think the first thing for you to do really, because of safety and the risk of spreading to other people, if there's any chance that you might have coronavirus, is actually you stay at home. And if you are not even sure that, I don't think this is coronavirus, it might just be a tummy bug, fine. Then speak to your doctor, get on the phone, speak to your GP, and the doctor will then, talk to you, and then we will action it from there, as opposed to just thinking, I have a tummy bug, and actually going out when you shouldn't, and possibly you might be harboring the virus and actually spreading it, okay? So it's really important that you are aware of this. Now, I'll share my own experience with you, okay? I said a few weeks ago, I had to go in self-isolation. Now, I don't know whether it was coronavirus. I probably think it was. The reason being because, I can't remember when I was last sick, okay? The last time I was in hospital was just to have babies. And, I'm not the kind of person that gets colds easily, gets flus easily, or anything like that, okay? But I remember exactly when it happened. It was the end of March, okay? It was a Sunday. I had gone out that Sunday to get some food products for the house. That's because we've been so busy with work. I did not have time to do shopping. And that was when they were talking about schools were going to close and possibly we're going to a lockdown. So I was thinking, I have little ones at home. I definitely need to make sure that they have their pasta. They have, the things that they like. So let me go out. And I went on that Sunday because they had announced that, NHS staff can actually, come an hour early to do their shopping, which I thought fantastic. My husband cannot go because he cannot use my ID because I'm a woman, sorry. And he's a man, right? So he cannot use my ID. So I thought maybe if he goes with my ID, they will send him back. So I decided to go. So I went, and unfortunately that day there was actually a lot of people in the shop. It was a big supermarket, Tesco's, in my local area, and I don't know whether everyone there was actually NHS worker, but there was a lot more because they actually opened it. Everyone was going in. They were not looking at your IDs. And there was a lot of people. And I remember particularly even one of the aisles that I was on, as I entered, I saw a lady standing at the other end coughing. And I just, nicely with my trolley, just turn around and move away. But, that day I just felt, oh my God. Anyway, I came home, and within an hour or two, actually, I said to my husband, oh, I don't feel well. I'm having a bit of pains. I'm having pains in my body. And that was it. Within a few hours of coming back home, I just started feeling so unwell. I've never felt like that before. I was in bed. I could not eat that evening. I had a temperature of 38.9. I've not had a temperature ever. I don't even ever remember having a temperature. I had a temperature. I started having a sore throat. I had a cough. My cough actually was a wet one. It wasn't a dry cough. I was bringing up phlegm, but I was very suddenly unwell to the point I was bedbound, and within, it took about 3-4 days of temperatures, body aches. I felt so much pain over my body, like someone has given me a good beating. When someone has really beaten you up, that's how it felt. Every part of my body was aching. I could not get up. I felt weak. I was just walking around the house and that was definitely not me. So it definitely was not normal. It wasn't just a normal cold or anything like that. Okay. And actually my smell went, my sense of smell, and that's another thing that is one of the symptoms that has been reported. My sense of smell was gone. I had a headache. The only way I could describe that headache was like someone has put a brick on top of my head. It felt like a heaviness. I could not shift it. It just wouldn't go away. It wasn't a pain. It just felt like a pressure. Someone had just dropped something and left it there on top of my head. And it was not funny. So you see how, it could just be, and I don't know when I picked that. Obviously, it was within that week that we had decided that we were not actually going to see patients face to face anymore in our practice. I think it took a lot of going back and forth, not just our practice, because the whole of obviously the primary care system had to make a decision for all the GP practices whether we should still be seeing patients or not. So actually, I thought a lot of the decisions were made very late, when we were having to make decisions, and a lot of doctors probably and healthcare professionals had already been exposed, yeah. But it just happened so quickly from being very well to being very unwell. So that's why, and it just suggests also that this infection is a very serious infection and you can't really take it for granted. Okay. Now, should I have gone to the shop that day? I went with the knowledge that, there wouldn't be a lot of people there. Unfortunately, there was a lot of people there. The only reason I stayed really because I was thinking schools are going to close. I will have to go to work. My children will have to have food, and I didn't really have much at home at that time. So I thought, okay, let me just stay. Since I'm here, let me just do the shopping and go. So I ended up staying. There was a long queue. We had to stay in. At that time, people were not really observing the distances from each other that we were supposed to, the 2-meter distance. So, so I stayed there longer than I wanted to. That probably did not help. And that's really for someone now to listening to me to, if you go out shopping, there's a lot of people there and really you can afford to come home and go another day, then please do that because you're exposing yourself. And possibly if you are the one carrying the virus, you are exposing other people to it. Okay. And I will tell you a bit more about what the things that I did to help myself when I was going through that, but we will deal more with that. I just wanted us to just focus on the symptoms first. Okay. Now, the next thing that I want to say to you that if obviously you have symptoms, what you're supposed to be doing is really staying at home. Okay, that's why the self-isolation is there. So you might be going through self-isolation because you are the person that has the symptoms, or you might be in self-isolation because someone in your house has the symptoms. So you too have to stay at home. And I think a lot of people have broken this rule and probably are still breaking this rule, particularly the people that don't have symptoms. Yeah. So if someone has symptoms in your house, they definitely know they are not well. So they need to stay at home for 7 days. Okay. However, if you are a relative or a friend living in that same house with that person that has symptoms and you don't have symptoms, you are not supposed to go out either. You're supposed to stay at home. Okay. This is really important because I suspect there's a lot of people that are actually going out shopping, going out doing things, going out saying they're going for exercise. Okay. And actually, they are supposed to be self isolating. And because they don't have symptoms, they're actually going out. But if you are in a house with someone who has symptoms, actually you are supposed to be in the house and self-isolating longer than the person with symptoms. Okay. So if you don't have symptoms and someone in your house has symptoms, you actually need to self-isolate for 14 days. And the reason why you have to self-isolate for 14 days is because actually it can take that long before people develop symptoms, even after exposure. Okay. So you may have been exposed to the virus from day one, just as the other person that has the symptoms, but because you don't have the symptoms. But actually, it can take up to 14 days for you to have your symptoms. Yeah, so that's why it's important that you actually stay at home, because it's likely that since you are in that same vicinity with the person who has the virus, you probably has got the virus, but you are among those people that don't show symptoms, okay? And it might take a matter of time before you show symptoms. So you shouldn't really be going outside as well. So it's likely that a lot of people are actually going out and spreading the virus and not knowing that they are doing that. So please be careful with that, okay? So we talked about main symptoms that you should be watching out for. We talked about the other range of symptoms that can also happen, okay? Now, what I want to highlight to us as well, actually, that over time, with all the cases that they are studying at the moment, that have people that have had coronavirus, okay, we've identified that there's actually 4 groups of people, okay, when it comes to this infection. So about 30% of people will actually be having the virus. They will be exposed to the virus. They will actually have the virus, but they will never have symptoms. 30%. That's a very significant number, okay? And that's actually also very worrying, okay? So that means that 30% of the population are walking around, they have the virus, and they're actually walking around because they will never have symptoms. They will never show symptoms. Yeah, and that's so important when it comes to social distancing, okay, and making sure you stay at home, because that means that you need to limit, particularly now we are in lockdown, you have no reason to be going out anywhere other than to get essential products, food or medicine, okay, or for exercise. But I would probably even say that if you have a garden in your house, please don't tell me that you are an exercise addict now, okay? Do your exercise at home. Do it in your living room, do it in your bedroom if it's big enough, or do it in your garden if you have it, okay? So you should actually be staying at home, because there's a chance that you might be among the number of population, the 30%, who will never show symptoms even though they have the virus, okay? And that means that when those people are out, actually they are actually potentially spreading it to other people, okay? So these people will never show any expression of symptoms, and they will build immunity, and that's fine. They will never have any symptoms. Now you have the next group of people who would have mild to moderate symptoms. Okay, so they might express any of the symptoms that I've listed before, but they will just have mild form of it. So they might just have a bit of aches and pains. They might have a slight cough, like some of my colleagues have said, I only just had a slight cough for a day and that was it. So they might just have a slight cough, a little bit of a headache, but nothing to write home about. So those people, they will have it. Because of that, they may be cautious, so they will self-isolate, okay? So after self-isolation, they actually better and they recover. They build immunity, okay? And they are fine. So this is about, actually, what's the percentage of that? Let me just check. About 55% of people, I've just seen my daughter just run it to me, which, sometimes you can't avoid when you're doing a live. So I had to say a quick hug, do a quick hug with her. Anyway, but 55% of people who have mild to moderate expression of symptoms, okay, and then they will get better from it, and that's it. And actually, the majority of us will fall into this category, and we are fine, and then we are better again, and then we move on. So obviously, when you have your symptom at that time, you need to self-isolate for 7 days. Okay. If obviously after 7 days you still have some symptoms, you need to wait until you've cleared all your symptoms before. But the main thing really is a fever. So if you have a fever and after the end of your 7 days you still have that temperature, then you need to still keep staying at home until the fever is over. The interesting thing about cough is actually you can have a cough longer than a week. You can have a cough for several weeks, actually, even after the infection has cleared. So having the cough after the 7 days does not mean that you still have the virus. It just means that it takes the body that long to actually clear the cough. Okay. So that usually is not a worrying problem. And if you are worried that, oh, I still got the cough, but you're actually feeling fine, no fever, your aches and pains have gone, everything else is fine apart from this cough, it's likely it's just the cough hanging around and actually you've cleared the infection. But if you're still worried, then get on the phone and talk to your doctor and they will reassure you. Okay. Then you have the next category of people who will have severe form of the infection. Yeah. Sorry, I feel like clearing my throat. Am I allowed? Okay. Yeah, that's fine. So I know no one can cough nowadays, isn't it? I need to ask permission before I do that. Okay. But I'm fine. Anyway, so you have a percentage of people who would have severe form of symptoms. Okay. So they would have probably all this, and they will have the fever, they will have high fevers that is not going away despite taking maybe some paracetamol, doing all the right things. They are not getting better, they're feeling short of breath, they're feeling a lot of pains, and so they're just getting worse. They might have chest pain even, so this obviously is not just okay. So these people will probably fall into the severe form of coronavirus infection. Okay, so these people often will need to be hospitalized, so they will need to go into hospital. And what I want to stress here really is that even though we've said that you need to self-isolate for 7 days when you start your symptoms, if your symptoms are progressively getting worse within days, so within that 7 days, if you're now becoming more short of breath, which you were not before, if you're having high fevers that is not settling, if you're feeling unwell, chest pain or anything, don't sit down and say, oh, let me wait for the 7 days to be over before I go and see the doctor. No, okay, you need to be getting on the phone, speaking to 999 or 1111, okay, triple ones really, because I think I get the numbers wrong sometimes. 999, okay, and actually be speaking to someone or speak to your doctor urgently, because actually you might be among those people that actually needs to be hospitalized. Okay, because it might mean that you need oxygen, or you might even need more than that, like ventilation. Okay, so yes, now the percentage of people that actually may fall into this category is 10%. Yeah. So actually, if you think about it, so the majority of us are going to be in the no symptom category or just mild to moderate. Okay. So if you add 30% and 55%, actually over 80% of people are going to fall into the category who will have either no symptoms or have a bit of symptoms and actually recover, get better from it without needing to go to hospital. Okay. Which is fantastic, which is a positive thing. Okay, so it's only 10% that will fall into the severe category, where they will have really symptoms bad enough that they need to be hospitalized. Okay, then the fourth category of people are the people that will end up being critical. Okay, what we call critical. So this is 5%. Only 5% of the population will unfortunately end up in this category, where they feel they become so unwell, they end up in ITU, they end up needing ventilation. Okay, so actually, if you think of the bigger picture, and actually when you look at the numbers that we're seeing in the news, we're seeing in the papers, actually it does go hand in hand, because we know in the UK alone over 100,000 of people have been affected in terms of they've been reported as having coronavirus. Okay, however, we've lost over 20,000 of people, even though that's a very big number in terms of deaths, because we've never experienced anything like that within a short period of time. Okay, but if you think about the virus itself and how many people have been affected compared to how many people have actually, unfortunately lost lives, there's actually more people that have recovered, okay, than the people that have lost their lives. So it's really important. So it's a lot, you have a lot of responsibility to make sure that you are complying with the guidance that have been put in place in terms of social distancing, in terms of hand washing, in terms of personal hygiene if you have symptoms at home, in terms of looking after your health, eating, making sure you're doing the right thing for yourself, because actually a lot of people can recover from this virus. So you don't have to be among the 5% of people that are going to end up, in on the death path. Okay, do you understand that? So I hope that is, something positive for someone to also, because I know there's a lot of anxiety and there's a lot of worry and a lot of concern about it, because we're seeing all the bad cases, we're seeing all the people dying. I've turned off my notifications because every morning, actually, BBC has decided to just tell my phone and tell me how many people have died today, and really, I don't want to know that anymore. I want to know the people that are surviving, because that gives more hope. Okay. But we should definitely be doing all the right things that we need to do to make sure that we don't become a victim, okay, of this virus. Now, the next thing that I want to talk about is, yes, now that you are in self-isolation because you got symptoms, what can you do to help yourself? So I've just made a list of self-care things that you can do while you are in self-isolation to help yourself, okay? Those things that you can do. So because we know, first of all, this is a virus, okay? So antibiotics is usually not treatment that you can, that would help it. Otherwise, doctors we would have been prescribing a lot for you, okay? But a virus does not really, antibiotics are not effective for viral infections. They are more made for bacterial infections, okay? So the things that you can do to help yourself: number one, hydration, and I cannot stress this enough. Drink like your life depends on it. I don't mean alcohol, okay? I don't mean any spirits, okay? I mean normal water. That's right. Normal water. Drink like your life depends on it, okay? If you are symptomatic, you are home. I mean, you know Dr. Ari always tells you about eating good and drinking and all that. Anyway, I tell you. So if you've been listening to my videos, I go on and on about, healthy lifestyle, okay? So this is an addition to that. So this is a double dose of what I always tell you. Anyway, make sure you're drinking like your life depends on it, okay? Drink a lot of water. We did that water challenge some weeks ago, actually, before all this started, and I say aim for 2 liters of water, minimum 1.5 liter of water. Make sure you're drinking in that episode, in that time when you are not well. Make sure even if you cannot eat anything, because when I was going through it, I could not eat. I remember, a day before, I had made some lovely, spinach soup, African way, actually, that I was really going to enjoy. Okay. But that day, when I was not feeling well, my husband actually plated it out to me. I just looked at the food and I was like, no, I didn't eat. I couldn't eat it. I couldn't eat. I just walked back to my bed and slept. I could not eat the food. So you will notice that your appetite will go. Okay. But the thing that will help possibly save your life is water. It still comes back down to the foundation. Drink, 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 drink like your life depends on it. Now, do things like honey and lemon, especially. You don't have to even put much honey in it because we don't want you having too much exposure to sugar either. Water, put lemon, put ginger in it, put garlic, in it as many times, and just be drinking it. Yeah, I made things like turmeric shots. Turmeric is very good. I spoke about it in the last video. It's very effective for a lot of things, and particularly for viral infections. Okay, so I made a shot where I basically had turmeric. I put oranges, because orange, remember, is a citrus fruit. It's very high in vitamin C, which is very important for fighting infections, viral infections at this time, and even for many times to come. Okay, so I put oranges, fresh oranges. Okay, not orange juice, fresh oranges with lemon, with turmeric, with ginger. Blended it together, and I made it was very concentrated, and I basically put it in a bottle, and I was just diluting with hot water, and I was just drinking it. I had more water fluid than I had food was not really important to my body at that time. So make sure you're drinking lots. Okay, improve your vitamin C intake. So obviously you can do this through citrus fruits and berries. Okay, so have a lot of berries and a lot of lemons, a lot of lime, a lot of oranges in your house at that time. Okay, get someone to get them for you. Make sure you're having vitamin D, like we talked about the last time on the last video. Vitamin D is very important at this stage in boosting and supporting your immune system. So have vitamin D at home supplements. Okay, if you cannot have vitamin D, vitamin C, fruits and things, have the supplement at home. So that this is the time that if you are not used to taking supplements, please just have it in your house anyway, just for moments of self-isolation, okay, and needing to survive. And then zinc as well, okay. So just have that at home. Like I said before, increase your intake of vegetables. So what I did, because at this time you're probably not well, you don't feel like eating, but more likely you would want to drink. Okay, so this is the time that maybe even doing smoothies will help you. But your smoothies, make sure you're having more vegetables, so green stuff, spinach, kale, cucumber, have kiwi. Kiwi is a good source of vitamin C. So have the right vegetables and fruits in the smoothie. So it's a form of liquid, but at the same time, you're getting the nutrients that you need to help you to cope. Okay. Make yourself get up and walk around. Okay. So when you're not feeling well, trust me, like I said to you, I was having pain like never before. I felt like I've been beaten. But you need to make yourself get up. You need to make yourself get up when you're going through self-isolation. Don't just lay in bed. Okay. That's you saying, oh, yeah, sickness, just carry on. Yeah. Just get up. You need to have a fighting spirit. You need to get up and walk around the house. If you have a balcony, stay there, get some fresh air on your face, open the windows, okay, go into the garden, just walk. Even if you're just like going like this, like an old lady, that's fine. Just do it, okay. Just make yourself get out of your bed and go out and just walk, okay. Walk around your room, walk from one room to another. Make yourself go to the kitchen, not to cook, but just go there anyway. All right. So it's really important you make yourself move. Have warm baths. I found that just soaking in warm water was helpful for me because it just helped me to relax. Yeah. Because one thing that is so easy to creep up in the midst of your self-isolation is fear. Fear that, oh my God, this is going to get worse. I've got the virus, because really you don't know whether you got the virus or not, right? It's likely you have the virus, but you've not been tested. And unless you are tested, you don't know. And you're probably never going to be tested, okay? Because I never got to have the test, even though now the test is available, but because I don't have the symptoms anymore, I'm not going to be tested, okay? Until maybe when later they're testing people that have immunity, then maybe I will have a test. But I never had the test. But when you're in your bed, feeling very unwell, it's easy for fear to creep in and think, oh God, I'm dying, I'm going to die. And probably you're still watching your Facebook, you're watching your WhatsApp and looking at all those messages of people dying, which is going to scare you even more. You don't want to do that, okay? So this is the time for you to, do things that will help you to relax. So I found that actually just going into the bath, having a warm soak, that's something I do regularly anyway before coronavirus. I do that regularly for myself. Anytime I feel tired, stressed, I have a soak. I have my own homemade spa, so I normally use that, to my advantage. So I found that very helpful. So do something relaxing for yourself. I put here breathing exercises. I found that really helped me, okay? There's no right or wrong. There's a few actually on YouTube now. A lot of the doctors have actually put a lot of useful videos for you to watch about, helping with your breathing. I would even say that even you don't wait till you have symptoms to be doing breathing exercises. I used to do that just for me as part of my relaxation techniques that I do. So breathing exercises, and one of the easiest one that I found, from one of my doctor colleagues who also does a lot regarding lifestyle, is Dr. Chatterjee. He did something called 3-4-5, where basically you breathe in for 3 seconds, okay? You hold for 4 seconds, and then you breathe out for 5 seconds, okay? I'm not even going to attempt to do it for you because I did it on a platform for someone and we all started laughing. We didn't get it done. But basically, breathe in for 3 seconds, hold your breath, okay, for 4 seconds, and then breathe out, okay? Now, when you're doing the breathing exercise, is good. It's good to relax you, but also it's good to actually for the lungs because you're helping to improve the lungs capacity, okay? Now, obviously, if you can hold it longer, if you can breathe in longer and hold it longer and breathe out, fantastic, do it. But at least start from somewhere. So you can actually do that to help you. And when I was lying in bed, actually feeling unwell, I found myself that I was actually subconscious that I was doing it. I just found myself taking in, holding it and doing it. And that actually helped me psychologically, okay? So it's helpful. Also, this is the time when you are in self-isolation not to be watching all the bad news. please try and limit your time on social media at that time, because you don't want to see something that will scare you more, make you worry, okay? Because stress is one of the things that is not really good on the body. Stress actually dampens your immune system, okay? So you don't want to really stress yourself at that time. So try anything that you think is going to raise your emotional tension, okay? You need to try and cut it down. So cut out any bad social media. You don't need to know what is happening on the news. I haven't actually watched the news for a long time because I get a lot of the information from my doctor's platform. So I don't actually, I've not bothered to watch the news. I would rather watch a film than watch the news. So I don't watch the news, what the government is saying and everything, but I pick the information because of my job. But, one way I'm stopping myself and also exposing my children, not exposing my children to that, is I don't want them to worry, and I don't want to worry about unnecessary things as well. Yeah. So what's your favorite movie at this time? This is the time to watch a bit of junk TV, really. Yeah, I'm not a soap person or anything like that, but give me a good film and I will sit down and watch it all day. Okay, so this is the time for you to just not be too serious about life. Just watch a favorite movie. There's a lot of Netflix now. Just watch something that you enjoy, something that will make you laugh, even though you don't feel like laughing. Please do laugh. Just sit in the living room and just watch something boring, something exciting, something that will just make you happy. Okay. Stay positive, please. You need to have a fighting spirit, particularly in that time. That's the time that you have to say, I'm not going to be among the 5%. I'm not going to be among the 10%. I'm among the over 80% that have survived. It is fine. I'm going to be okay. I will get through this. You need to be positive. You need to speak to yourself. You need to speak positive to yourself. Okay, this is the time for you to stay positive and be strong, and you will get through it. I got through it. I know a lot of people that have gotten through it, and definitely you are not different from that. Okay, of course, we don't know what tomorrow holds or anything, but what we know is that we can always hope for the best, and actually having a positive mindset actually goes a long way. It does help. Okay. The other thing that you can do while you're in self isolation is that let someone know. Okay, so particularly, of course, like I said, if you are in self isolation because you have the symptoms, you definitely can't go out. If someone is in the house with you, they can't go out. So now, who is going to do the shopping? Okay, so you need to let someone know. Obviously, you can either order online. Okay, now there's a lot of support groups in the community. Yeah, and even in my neighborhood, I know they put a lot of flyers in our doorpost to let us know services that are available. So if you need someone to pick your shopping for you, they'll come and drop it at the door. So there's no even excuse at all for you. There's no excuse at all for you to actually step out of your house. So this is the time for you to let someone know, let a loved one know, let a friend know that, guys, my family, we are in self-isolation. We can't go out. We need some shopping done. This, when you do your list, send it on WhatsApp. Let someone do the shopping for you and drop it for you. Okay, it's really important that people know that, wait, maybe this is what is happening. The whole house is unwell. They can't go out. So people are watching out for you. They can call you. They can check on you, because this time is really important, and they can even get the right help for you if it's needed. Okay. 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 Now, the next thing that you can do as well, the next thing that you can do while you are in self-isolation is medication. Like we said, you can't take antibiotics because it's a virus. However, simple things like paracetamol can help you. But don't just take paracetamol just because of the fever, actually. The guidance says that you should take it really when you have other symptoms. Of course, if you have the fever, it's a high fever, it's not going down, you try to cool yourself down, you try to remove layers of clothing, to try and get some fresh air, and it's still not, and it's distressing you, you are not well with it, then definitely do take the paracetamol. I know there's a shortage of paracetamol, actually, because a lot of people have hoarded it. But if you have to take something, you can try low dose cocodamol. Ask the pharmacist. The pharmacist can actually guide you. Okay. Also, with the cough symptoms, if your cough is very distressing, is not getting better, like some of the things I've said, like hot drinks and stuff, they actually do help solve the problem. But if it's not helping, you can try a cough syrup. Like codeine linctus can be effective, okay, for this. You may actually have to speak to your doctor about that to get that, or speak to the pharmacist and they'll recommend something for you, okay? The next thing that I put here is that what can you do to avoid the spread of virus to others while you are at home, inside your house, okay? So if you are the person that has the symptoms, but other people do not, of course, we sympathize with you, but it's not an excuse to spread the virus to everybody else. Okay, so as much as possible, you're still doing all the things you need to do. Washing your hands, okay, at least for 30 seconds, okay, with warm to hot water, whatever you can tolerate in terms of temperature wise. Okay, wash it with soaps. Make sure that you are, if you're coughing, yeah, you're not just coughing on top of everyone, you're not sneezing on top of everyone. Make sure you're doing your elbow coughing, your elbow sneezes. Okay, make sure you're using tissue, okay, when you cough or sneeze into it, okay, and then dispose of it immediately. Make sure then obviously you're washing your hands again. Of course, if you're at home, you're going to have water. But if you don't, for whatever reason, your hand sanitizer, of course, is there. Use that, okay? And also make sure you're not sharing towels, clothing or anything like that with other family members at the time that you have the infection, okay? And of course, if you don't have the symptoms, then this is the time for you to really be looking after yourself at that time, yeah? Make sure that you are drinking all the things that I've said. You should make sure that actually you're doing, I think you should all be self-caring and looking after yourself at that time. Now, for people that have bigger houses and lots of rooms who can afford to actually keep one person in one room, fantastic. If the person is willing to stay there, why not? Let them stay in their room, okay? And then, make sure that they're getting food though and water and all the things they need. But if you are living in a house where you are limited in terms of space, then you just have to make the most of it. The main thing is that you're all being safe, you're all being cautious, you're abiding by the rules, okay? And actually, in the bigger picture, most of you should be well and should recover, okay? The next thing that I want to say is that if, for example, you are self-isolating, so because of that, you've had to take time off work and you need a sick note. Now, if you're just self-isolating because of coronavirus, okay, your GP, your doctor actually does not need to give you a sick note because the guidance has been made clear, okay, that we know this is a national problem, this is even a global problem, okay, and so guidance have been put in place for those things. So if your employer is saying, oh, because you're self-isolated, go and see your GP, actually, they've not read the guidance themselves, okay? The guidance says that if you are self-isolated because of coronavirus, actually, you can get your sick note directly from NHS website, okay? If you go to www.nhs.co.uk, okay, and or type in Google coronavirus NHS, it would actually come on, and if you search for sick note, there is a template, you can fill in your details, and actually they will send your sick note via email to you, and you'll be able to have it and send it to your employer, okay? So you don't need to speak to the doctor for your sick note just because you are in self-isolation. That has been covered by NHS. I don't know what the protocol is in other countries, but this is something for you to find out if it does affect you. And then finally, I think I just need to buttress the fact that, okay, this is a very serious infection. Yes, a lot of people are recovering, but also we know that within a very short space of time, we have lost a lot of people, quite a significant number of people. Never before have we lost this amount of people. So it is very serious. We have said that some people, actually 30% of people can be walking around with no symptoms, even though they have the virus. So it's really important that we are abiding by the rules that have been set by Public Health England, and also not just that, World Health Organization, and also by the government in terms of social distancing, making sure that you're not going out unnecessary, you're only going out for essential products, which is what? Food and medicine, okay? Things that actually you need to survive this time, okay? So don't just go out. Exercise, yes. I'm not even sure why the government put exercise, really. I know we need to move, but we could have done that in our houses or in our gardens, okay? But if you need to go out for that exercise, then please make sure you're going out at quieter times, you're staying out shorter times, and you're coming back home. Make sure that when you are having symptoms yourself, you're not taking any risk to go out, you're staying at home. Make sure that you're washing your hands as usual, using your hand sanitizers. And importantly, also making sure that you're looking after yourself. You're putting the right things in your body, you're eating well, you're hydrating well, you're supplementing well, and I wish you the best. I hope that, we all come out of this. I'm really looking forward to the day that, when I finally listen to the news, they say, oh, today we've not had any case at all. Yeah, we are all praying and hoping for that. So thank you for tuning in. I hope this has been helpful. Please share the video, because particularly I know, I mean, in UK, the restrictions are there, the regulations are there, but I know definitely a lot of my followers or people that listen actually on this platform come from other parts of the world where it's not so much and people are not aware of the symptoms, people are not taking things seriously. Please, let's do our best. Okay, so share the videos with people so that people can learn from it and benefit from it. And actually you might be saving a life, because of this video, someone actually with symptoms will stay at home when they have been going out. Definitely the video that we did on when to seek help, someone sent a message to me saying, you know what, after that video that my friend listened to, she has decided to go and see her GP, or call her GP and talk to her GP, because she was having some symptoms, but she was afraid to go and see anyone or go to the hospital, so she was ignoring it. But because of watching that video, she made the right choice to actually talk to her doctor and get it sorted. Okay, so please, it might not be helpful to you because maybe you know it all. Fantastic, amazing, yeah. So double dose, but please share it with someone who doesn't know. Okay, I'm sure there's a lot of people out there. So thank you for joining in, and hopefully next week, yes, we'll catch up again. I'll tell you then what we're going to talk about something really important. Okay, bye bye. Have a good day, a good evening.